This is WABE's Week in Review, the show where we look back the last few days of stories from your WABE News team. I'm Alex Hummock, managing editor of WABE News. And we start today with DeKalb County Schools Superintendent Devon Horton resigning on Wednesday, days after a federal indictment against him in the state of Illinois for an alleged kickback scheme at his previous school district. WABE's Raul Bali had more.
The indictment is tied to Horton's time as a superintendent of a suburban Chicago school district. He is accused of taking part in a kickback scheme that earned him thousands of dollars.
My first thought when I saw that was, we just can't get a break.
That's Democratic State Representative Doreen Carter of Lithonia.
I say that because I thought that I really felt like we as a school district, we were moving in a really good direction.
Carter is chairing a newly formed special committee charged with gathering facts, evaluating current laws, and developing legislation to prevent similar situations. That means the committee's recommendations could go beyond DeKalb.
I personally represent 3 different counties, so there could be some opportunity to have a larger conversation with more members. But right now, our focus is on DeKalb residents, DeKalb children, DeKalb parents.
The DeKalb County School District is one of the largest in the state with more than 90,000 students and 14,000 employees. Raul Bali, WABE News.
Horton's last day is set for November 15th. Well, more than 6 detainees at the Fulton County Jail are currently sleeping on the floor, while a new diversion center designed to help prevent overcrowding is struggling to fill its beds. WABE's Shemaine Cruz had that story.
Any police officer in Fulton County can bring someone to the Center for Diversion and Services in Atlanta if they think the person is committing a minor offense because they're living in poverty, have unmet mental health, or substance abuse issues. Steve Narwaki, Fulton's Director of Justice Systems Programs, says the center can serve 40 people a day. Here he is answering a burning question from Commission Chairman Rob Pitts on Wednesday.
So in your opinion, is it working or isn't it working?
As the county manager said in his remarks, I'm not running the diversion center. I was not part of the team that developed the forecast, but what the numbers show is that the daily census is dramatically below than I think what they had originally planned on.
That's because on average, it's seeing just 3 people daily since it opened in January. Over the summer, commissioners held a luncheon for all 15 police chiefs in Fulton County to explain the benefits of using the center, but it remains understaffed and underutilized, even with the county's investment of $2.5 million.
What is the alternative?
That's Commissioner Khadija Abdur-Rahman. She sits on the Justice Policy Board, which helped create the center.
If you want to throw away the baby with the bathwater and say it's not working, what's the alternative? Are we going to burden our sheriff, our courts? This is the ends justify the means.
Some commissioners think the center isn't getting used because police are letting too many business owners get the final say in whether an individual goes to jail when they're charged with criminal trespassing, or that officers don't want to make the drive from other cities. And yet the county is averaging about 2,000 admissions at the jail every month. Shemaine Cruz, WABE News.
At least 600 Centers for Disease Control and Prevention workers remain out of a job after the Trump administration recently fired about 1,300 employees and then reinstated some of them. Agency employees say the cuts further hamper the CDC's capacity to continue protecting Americans' health. WABE's Jess Mador reported the details.
Administration officials say the firings target waste, fraud, and abuse, but CDC centers affected include chronic disease and global health and a critical office for U.S. health data and disease surveillance nationwide. A scientist not authorized to speak publicly says the cuts leave the nation more vulnerable.
You wouldn't cut the military when threats are rising, so why are we firing our public health responders when measles, fentanyl, and other threats are on the rise?
The administration has eliminated the CDC's Washington office. It's historically been key to communicating accurate health information to Capitol Hill. Former staffer Abby Tai says she's worried about CDC's ability to function.
At this point in time, a quarter of CDC is gone. At the highest level in the CDC, there are no public health or medical professionals left to help guide CDC recommendations. billions in contracts and direct funding, and the American people are queued up to suffer.
A group of fired staffers is calling on Congress to demand details about the administration's handling of CDC firings. Jess Mador, WABE News.
TSA workers at Hartsfield-Jackson International Airport are caught in the middle of the government shutdown. Aaron Barker represents the local American Federation of Government Employees Union and says food vouchers donated by the city of Atlanta are helping a little before getting tangled in red tape.
I would not put the blame on the mayor's office at all. It's the TSA ethics piece that's getting involved and being the roadblock, I should say.
Okay, what are they telling you regarding those vouchers?
So the vouchers are $15 each, and the agency's policy is they can receive a maximum of $50 for a whole year. So that's where the ethics piece is coming in. So I don't know if something else is going to be worked out behind the scenes or from the agency side. I'm trying to get everything to come through me because I don't have those issues as the local president. So if there's anyone that is wanting to do any or have any support that they want to provide to TSA workers, please reach out to me directly so that I can ensure that the officers get what they need during this time and any support that's being offered.
What about your paycheck? October 10th has come and passed, so at this point they are getting a partial paycheck. Is that where things stand?
Some people received their paycheck on October the 11th. The officers are really feeling the pain from missing part of their paycheck, and that's where those vouchers come in handy. Any bit of money that they can save or, use to put towards whatever bill that they may have is a positive impact on them. So it would have been great if those vouchers could have continued to come through. But, because of that, now officers are really having to figure out what they're going to do with the little bit of paycheck or the partial paycheck that they receive.
What is morale like today?
I mean, officers are really like, hey, what are we going to do? They're getting to the point where they don't have the funds. Like, what am I supposed to do? Do I call off work? Do I show up? Those are the questions that are coming to me. They're really concerned about if they do have to call out, will I get fired? Those are the things that are on the forefront of officers' minds right now.
What's on the forefront of your mind?
I mean, I want to do whatever I can to help, my fellow, my members that are in my local, whatever resources I have to give it to them so that they can, have a little bit of peace of mind. As always, my stance has been, come to work until you can't. Once you are unable to make it to work because you don't have the means or you have to make that decision, make sure you communicate with, management and let them know, hey, I want to come to work. If you all send a car to come pick me up, I'll come to work. I just don't have the money to put in my car. Or, if they have not daycare issues where they can't pay a babysitter or for daycare, because this week is fall break here in Atlanta. If those funds have run out, you got to I'm encouraging my members to do what's best for them in this situation.
That's WABE's Lisa Ray. I'm speaking there with Aaron Barker, who represents the local American Federation of Government Employees Union. TSA officials did not respond to requests for comment. You're listening to WAB's Week in Review with me, Alex Helmick. Reminder, early voting is on now, and for more information, check out our election guide. That's at wabe.org/2025 election. Well, a nurses' union in Georgia is expressing concern over the Trump administration's so-called One Big Beautiful Bill Act's cuts to health care, including the proposed expiration of ACA marketplace tax credits. Those credits make health insurance more affordable for millions of Americans. Other concerns include big cuts and other changes to Medicaid coverage for low-income people. American Nurses Association President Jennifer Mensick Kennedy spoke with WAB's Jess Mador about how all this could hurt access to health care, especially in rural communities.
Help us understand why Medicaid funding cuts would hurt so many rural areas.
Rural hospitals are typically at a much higher percentage of Medicaid patients than our urban and suburban counterparts. Rural hospitals have been underfunded for decades. So this is a systemic problem with how we have helped to support them. And these are lifelines in our communities. We're basically cutting all, the revenue sources that are vastly important to these hospitals.
So what does this mean in terms of healthcare facilities that might be at risk of closing?
There's about 45 hospitals and clinics that are at risk of closing in 35 counties. They can't run in the negative. Labor and delivery, OB services, are a higher percentage of Medicaid, so they're going to cut OB. You're not going to be able to deliver your baby in your community. You're going to have to drive 30, 40, maybe 60 miles to deliver a baby. Now, what if you were having a stroke, or what if you were having a heart attack? Your likelihood of surviving a heart attack or stroke with very minimal negative outcomes is very much in relationship to how fast you get to the emergency room to get treatment started. And if you can't get there within the 30 minutes, you will have longer lasting effects if you survive your stroke or heart attack. That emergency room closes, now they're going to be at risk for any type of issue that could increase their risk of dying from things that we could prevent or stop if the hospital was open. And that's why it's so important having these hospitals in our communities. They're going to wait longer to get treated and come in sicker and in a worse condition. And it's going to cost the hospitals more money because, of course, we're going to take care of you because you're a human being. That is in our code of ethics, to make sure we do everything we can to save you, regardless of your ability to pay. And so I think people need to recognize we're going to see a lot more moral distress.
So we've touched on how the funding losses could affect hospitals and patients, but what about doctors and nurses and other providers?
Because of the uncertainty of how this really is going to play out, we're seeing organizations in this uncertainty not hiring, not putting out positions as individuals leave, not filling those positions, or even laying off people. And so what that does is then it provides a higher workload for the staff and the nurses who are at that hospital. We know time and time again, we just got past this with COVID. Those high workloads increase burnout much quicker, and then those nurses will leave the organization to go somewhere else with a less of a workload. So it's going to cause Georgia to have an issue in attracting and retaining nurses when one of the results is going to be people are going to have to do more with less.
You and others in healthcare have talked a lot about the impacts of these looming Medicaid cuts and the proposed expiration of the ACA marketplace tax credits, which have fueled the government shutdown. Do you think the message is being heard in Washington?
I am very hopeful that Congress will figure things out in the next couple of months. Marjorie Taylor Greene has come out publicly saying the subsidies are extremely important. Hopefully other members of Congress will also see what it's going to do to their constituents. And we need to come up with a solution very quickly so that we can keep people whole and not have even more people going without health insurance.
That was American Nurses Association President Jennifer Mensick Kennedy speaking with WAB Health reporter Jess Mador. The union has about 2,500 members in Georgia. Changing gears now, an Atlanta staple for more than 3 decades closes its doors today. That's Saturday, October 18th. WAB's Julian Virgin had a look at the impact of Eats on Ponce de Leon Avenue with customers, former employees, and its owner.
During lunchtime at Eats,
always a little bit of a line at a door, which is a good sign for a restaurant.
Leland Robinson says he came from Tucker for the chicken tortellini. Known for its trademark jerk chicken, Eats first opened in 1992. 73-year-old owner Robert Hatcher is still bussing tables at what he calls
a neighborhood cafeteria.
That's now going away.
I'm not going to blame it entirely on the traffic in front of here, but when the Beltline Committee tore up all the sidewalks from Freedom Parkway to Monroe, and then Ponce City Market builds the Pottery Barn, it's just been lane closures, and I kept it open until a few months ago. It just started losing money. It was a good run, but I think its day was over. So
the restaurant announced it'll be closing its doors on Saturday.
I got till the 18th. and then I'm going fishing.
Since the announcement,
Been getting a lot of love, but it's a little bit bittersweet. You want to say to someone, well, where you been? You know.
I've been here twice since I've been out there closing, and I will be here every day that I can get here until they're gone.
Randy Campbell says she's been coming here since her teenage years.
Walking into this restaurant is a place that feels like home.
Today, she ordered her regular jerk chicken, collard greens, and cornbread alongside her teenage son.
I was telling him the first time I had food with his dad at a restaurant was here. I remember breaking the news that I was pregnant here. I remember coming here the day I signed my divorce papers, just saying goodbye to a good friend or a family member, or it's just special. It's special. It's really sad to see it go.
Hatcher says he won't miss running the restaurant, but he'll miss the people.
I love everybody that ever set foot in here, and we thank you for a beautiful 32 years. God bless you.
Julian Virgin, WABE News.
And finally today, a note of remembrance. Funeral services for State Representative Mandy Bollinger were held Friday in Cherokee County. Bollinger passed away Sunday after a long battle with cancer. She was just 50 years old. The Republican from Canton served in the State House since 2013 and was known for her advocacy for juvenile justice and domestic violence survivors. That's all for the show this week. My thanks to the WABE News team for all the great work. You can find more at WABE.org. Thank you for supporting WABE News and for listening to The Week in Review.